you're going to be helped along a bit, I suppose, in the next half because you're going to be able to finally bring in that premium increase that has been approved, that was obviously deferred. But in terms of some of the inputs to the need for the premium increase, you're being pretty vocal when it does come to the pricing of a number of things like prostheses that has been going on at the moment. Just how much of an impact does that have when you decide that you need to increase by, say, 4% or X amount when it does come to your calculations?
Oh, look, it's significant. And, we estimate the overpricing of medical devices in Australia is costing the consumer about $500 million a year. But look, having said that, it's on us to control prices and the impost that, medical cost put on consumers. So, we're not hiding behind factors such as that. We're striving in the business on a number of fronts to make private health insurance all the more value for consumers and all the more affordable. Recognising that affordability is a relative construct, it's relative to what value you get. And as a company, probably the thing we're most excited about, well, not probably, it's our number one strategic priority, is become more about people's healthcare rather than just their sick care. Like most private health insurers have built their businesses around responding to consumers once they're already sick and injured. The future for us is very much about using the power of AI, big data, IoT, 5G to be much better at predicting risk at an individual and population level. And as a business, putting in place programs which are about preventing or mitigating that risk of disease. So ultimately, the long-term goal for us as a company, sure, cost control is important. Sure, we need to make right some of the overpricing within the system and the overutilisation. But our future is very much tied to one in which where the value proposition for consumers is helping them and their doctors and other providers understand their individual risk profile and more actively managing those risks.
Since we were talking a moment ago about premium increases, Mark, I just wanted to ask you about what has been, I guess, a lot of negative public criticism of the general cost of private health insurance and whether or not people are really getting value for money, especially when obviously everyone also has Medicare. Do you feel that COVID-19 has fundamentally shifted people's perception though?
Mandy, I don't know if it's fundamentally shifted perception, but we've certainly seen a tick up in sales year on year, and we've certainly seen a tick up in retention. We're certainly seeing a heightened level of interest amongst younger people, people under 40, so 52% of our sales in the first half were to under 40s, and about 45% of our sales were what we call new to category. That is, people who hitherto have not had health insurance. So there is certainly a greater sense of value, it seems, in the community around the importance of private health insurance. And of course, the impact that COVID-19's had on the public system and waiting list is adding to that. So yeah, I think COVID-19, look, nobody celebrates the misery and tragedy and disruption of COVID-19 for so many, but it seems to have helped, at least our market conditions.